First year, I thought I played with I used to play with before. I thought I played with Heidi and then
Lori Light?
Laura.
Yeah.
Heidi and Lori, and then one other person. Hey, one other, more.
No, it's more.
Good, good. Hey, Dan, it's Matt. At the press conference with Sam Page. I'm walking in front of the camera now. Just give you a little quick mic check. 1, 2, 3, 4. You hear me? 1, 2, 3, 4. Mic check. Sure. Yeah, 1, 2, 3, 4. Joe, you good? All right. I gotta go. He's coming in. All right, cool. Thanks. Thought I was gonna do that there for you, didn't you?
Good morning. Mental health is a rising concern in St. Louis County. When we asked residents earlier this year to weigh in on how to spend federal relief dollars, providing access to mental health services was among the top priorities. More than 75% of those who took the community needs survey said they'd like the federal funds used to expand mental health services. For St. Louis County's Department of Public Health, the need for mental health services in the county far exceeds capacity. Based on the first quarter of this year, the Department of Public Health is on track to see more patients who need mental health services than in the last 5 years. Until this year, the health department was seeing about 2,300 patients a year for mental health. This year, that number is on pace to exceed 3,000 patients. In the county jail, 40% of detainees are admitted with a mental health and/or substance use disorder, and our health department staff there are working to make sure that we meet those health care needs. The health department provides a host of mental health services through its 3 permanent clinics. All regular patients of the clinics are given a screening for depression once a year. The mental health services provided at each of these centers include psychiatry, behavioral health consulting, mental health counseling, substance abuse counseling, and medication-assisted treatment. Because of the increasing need, the health department prioritizes those on Medicaid and those without health insurance. For many patients, the Department of Public Health provides referrals to partner organizations such as Behavioral Health Response, Places for People, BJC Behavioral Health, the DePaul Mental Health Urgent Care, Prenatal Behavioral Health, the SPOT at Washington University Epworth, the YMCA, the Women's Safe House, and many others. But given the overwhelming community need, there must be more done. There are 2 areas in which the health department could dramatically expand services if funding were available. The first is mental health case management. This is where trained clinicians work closely with patients to address their physical, emotional, and environmental needs. After a thorough assessment, the health department would work with a variety of community partners to link the patient to free of charge care, creating a path to successful treatment. The second area we need to expand is substance use treatment. And this includes a dramatic increase in our prevention treatment and harm reduction programs, specifically for alcohol and opioid use. St. Louis County has seen a steady rise in drug overdose deaths, largely driven by illicit fentanyl and other opioids. There were 343 opioid-related deaths in St. Louis County in 2021, the same number as 2020. And this number is a record high for opioid-related deaths. The third time, there have been more than 300 opioid-related deaths in St. Louis County in a year. Communities across St. Louis County have been affected. There were opioid-related overdoses and deaths in almost every zip code in the county. With the help of several partners, the Department of Public Health is updating and expanding its opioid action plan with more goals and expansion of programs. And this new plan should be completed in the coming weeks. The plan will lay out coordinated actions between organizations to combat substance use disorder and overdose in the community. Under the plan, we would increase the availability of Narcan to rescue people experiencing overdose. And all county police already carry Narcan, as do many of our municipal police departments. We currently provide Narcan free of charge at our public health center and to everyone discharged from the county jail. The plan would also increase the number of people connected to treatment with a focus on high-risk populations and enable people to recover and to transition to stable housing, employment, and family life. We do have funding opportunities in St. Louis County that we've never had before. The county will receive about $45 million from the state's opioid settlement that was announced in February, allowing us to provide more resources for substance use and mental health. The state's $458 million settlement with the three biggest U.S. drug distribution companies and drug maker Johnson & Johnson was a result of bipartisan unity to go after those who have caused so much harm across the United States. The county has also $74 million of unappropriated federal relief funds from the American Rescue Plan Act, and my office is working with the county council to determine how best to use these funds. Our health department are an access point to health care for most of our most vulnerable residents, and expanding services mean we can provide mental health services to more people. Doing so can help addiction challenges, overdoses, and the overall health of our families. During Mental Health Awareness Month, it's fitting to highlight some of the resources available, especially to our children. St. Louis County Children's Services Fund, approved by voters in 2008, generates about $42 million a year through a 1/4-cent sales tax. And since the first allocation in 2010, the Children's Services Fund has invested over $400 million in local nonprofits and government agencies to provide mental and behavioral health services for children, youth, and families in St. Louis County. Children's mental health has been identified as a health crisis by the Surgeon General, by the Children's Service Fund, and the Children's Service Fund is working with the St. Louis Mental Health Board on innovative ways to meet the increasing needs of children and families. Families are hurting. Our children should be looking forward to a summer of fun with their friends and family, and instead they're trying to process the unfathomable, a mass shooting in a Texas elementary school. Children a few days away from summer break being gunned down. My remarks today have been focused on mental health, but I can't step away without saying that we must have stronger gun laws in this country. Thoughts and prayers alone won't do it. We must protect our future, and I hope the press will share a resource that we are fortunate to have in St. Louis County, the Youth Connection Hotline. Run by nonprofit Behavioral Health Response, this helpline is funded by the St. Louis County Children's Services Fund, and it's available 24/7, 365 days a year. You can call 314-819-8802 to be connected with a mental health provider, or you can chat online at www.bhrstl.com. Thank you, and I would be glad to take any questions. Yes?
Hi there, Dr. Page. You just mentioned that we're in the midst of yet another mass shooting. After this school shooting in Uvalde, a lot of communities across the country have talked about mental health resources and whether or not their area is doing enough. How would expanding what we're doing in St. Louis County potentially help us during this really tough time that we're all trying to get through?
Well, first of all, I think we need stronger gun laws in this country. We need to pass a red flag law. We need to close the loopholes for background checks. Those are both federal laws. At the state level, we need to fully repeal the Second Amendment Protection Act, which prevents our St. Louis County Police Department from cooperating with federal departments on violent crime in our community. At the local level, our control is mostly about providing mental health services, and we have exhausted our existing resources for the services that we have. We provide them in our clinics. We provide them through the Children's Services Funds. We coordinate with our public schools. But in the end, we need more resources, and we need to prioritize mental health funding in our community through the resources that we have available in the Department of Public Health. And when we get new resources, such as this opioid settlement, then we need to put those funds to work as well.
Dr. Page, how would a separate gun law help when most criminals are not abiding by gun laws anyway?
Well, that's an argument that we hear a lot, but I do believe that any law that is passed, there will always be exceptions. There are always people that don't follow those laws, but that doesn't give us a rationale to not have stronger laws. We know that if we had stronger gun laws, they would catch and they would help us protect many people, and lives would be saved. There would be those that slip through, like they slip through every law, but having people avoid following the law would not be a rationale in my mind to not have better laws.
What would a plan to increase resources for mental health look like? Are you talking about opening a new clinic, hiring more staff?
Yeah, so we have a lot of opportunities, outlined some of those in my remarks, but in summary, I would like to expand one of our North County health centers, expand their footprint, expand the mental health services that they provide, more resources for direct care and direct treatment, and basically provide more providers in the community to expand, to focus on those services. We talked about case managers. The case managers could make sure folks, in addition to getting mental health treatment, also had support services that are available in the community, wraparound services, access to housing, access to workforce development and job training. We could provide better programming in our jail for our detainees. 40% of the folks coming into jail have mental health diagnosis. We want to make sure when they leave that mental health diagnosis is taken care of and they have access to medication. Half the folks in our community now committing crimes were once in jail, so it's very important that when they leave our custody that we have a plan to help them make better decisions, and part of that is making sure that their mental health needs are taken care of.
Dr. Page, we had a couple write-in questions. Regarding with schools, they've been dealing with an increased amount of mental health cases lately. How can the county support districts during these unprecedented times?
So the question is about partnerships with our schools in St. Louis County. We have a lot of partnerships with the Public Health Department and our Department of Human Services, through social workers that are in schools, through school nurses. Our school nurses meet on a regular basis with our Department of Public Health to make sure they have access to our resources, our policies, and our planning and our strategies. We provide some direct resources in public schools as well, especially the schools that have the greatest needs, and we'll continue to do that. But if we have better funding in our health department, and we know that in our country, historically, public health has not been prioritized, but if we have better funding in public health, then we'll be able to direct more of those resources to our partnerships that already exist with public schools.
Turning to ARPA funds specifically, Public Radio mentions that we spent about $119 million of these funds. It's a two-part question. How do you think the initial allotment will help the county?
Well, the initial allotment was focused on our greatest needs, the public health response, and mental health was part of that, and crime and public safety. And we'll continue to prioritize violent crime and public safety in our community. And I think what we'll see out of this next allotment, we hope, is a focus on problem properties, a focus on workforce development, and again, a greater focus on addressing violent crime in our community.
Right. Anyone have anything else? Great, thank you very much.
Okay, thanks. Thanks, Jesse.